In this presentation, we're going to talk about managing caregiver stress. So over the course of this presentation, my goal is to help you understand where stress exists in the role of a caregiver, specifically a family caregiver, to identify signs of caregiver stress in yourself and in others, understand how to manage caregiver stress, and identify resources for caregivers. So first, let's talk about stress in general. Stress is a normal bodily reaction to change, both what we might consider a positive change, like starting a new job, adopting a pet, or even having a baby, or what might seem like a more negative change, so like loss of a loved one, or to a much less severe degree, preparing for a test. In isolated experiences, stress can be helpful as it releases chemicals in the body that keep us alert, motivated, and ready to take on danger or threat. So while stressful experiences can be good or bad in a sense, the stress response that we have is our body's way of preparing us to deal with it, regardless of what it is, which is typically good. Stress can be acute, meaning it's short-term, like running late for a doctor's appointment. And in cases of acute stress, our bodies react and then return to baseline somewhat quickly. But stress can also be chronic, which is when a person faces continuous challenges or changes without a chance to come back to baseline or normal, how you were in between. Chronic stress is a lot tougher on the body, and if it's left undealt with, it can lead to distress, which would be mental health problems and even physical conditions. Our stress response occurs from a part of our nervous system that's called the autonomic nervous system. And this has a direct role in causing physiological changes in our bodies in order to deal with stress. The autonomic nervous system is divided into two subsystems, being the sympathetic nervous system and the parasympathetic nervous system. And when we experience stress, our sympathetic nervous system contributes to a fight or flight response by releasing stress hormones that cause our heart and breathing rates to increase, our blood vessels to dilate, digestion pauses, and energy starts to become saved in our body, going to dealing with the threat at hand. It's quick, and it's designed to respond to emergencies and then return to normal or baseline after the crisis or threat is managed. The parasympathetic nervous system, on the other hand, facilitates recovery by promoting what is called, sometimes called, rest and digest. The parasympathetic nervous system conserves energy, slows down your heart rate, and promotes digestion. And as you can imagine, the constant physical reactions triggered by the sympathetic nervous system in chronic stress takes a toll on the body. It's important to notice stress and intervene with stress management to avoid long-term negative health effects or burnout. So we want to minimize the amount of time we're activating that fight or flight so that we can allow the rest and digest process to activate. So caregiver stress is a more specific stress that's related to the nuances of holding a caregiver role. Specifically, caregiver stress is something that caregivers experience when the demands of caregiving extend beyond what they can provide. So depending on the context and the person a caregiver cares for, caregivers may experience stress related to safety concerns, thinking about things like driving, supervision, wandering, smoking, even firearms, as well as stress related to declines in their personal health and well-being and social support. Increased stress can lead to feelings of feeling anxious, frustrated, stressed, overwhelmed, or depressed. So who are caregivers? A caregiver is a family member or someone with a significant personal relationship who provides substantial, necessary, regular, and long-term care for someone. Caregivers are actually rarely trained health professionals or individuals who are paid to do it as their job. Family members are a vital source of support and care for older adults with physical, cognitive, and mental health problems. And in some families, caregiving for an older relative occurs gradually over time. For others, it can happen overnight. Caregivers might be full or part-time, live with their older relative, or provide care from a distance. And it may be family members of any age or relation. Family caregivers provide a wide range of services, from simple help, such as grocery shopping, to medical care, to 24-hour supervision and care. The National Alliance for Caregiving estimated that 65.7 million Americans, which is 29% of the United States adult population, identified as family caregivers. And about 43.5 million adults care for a relative, 50 or older, and then almost 15 million provide care for a family member with Alzheimer's disease or another type of dementia. So this is a very common identity and role that people take on. Although the experience of caregiving will vary from person to person, generally there are similar symptoms that occur when caregiver stress is experienced. So in the physical domain, the caregiver might feel exhausted, have trouble sleeping or feeling like there's not enough time to sleep, staying up worried about their loved one. They might have trouble concentrating, even on things that are familiar, like making appointments. They might have their own health problems as a result of investing time and energy and burnout into caregiving. And they might experience a loss of or increase in appetite. Emotionally or psychologically, the caregiver might experience denial about the disease prognosis, thinking things like, I know that they're going to get better, so false hope. They might experience mental health concerns like depression or anxiety about the future, unsure of what will happen if their care isn't enough. They might become irritable or frustrated, easily distracted, or even start to feel resentment towards the loved one that they're caring for. And then to cope, a caregiver might withdraw socially. So they might withdraw from friends or activities that they used to find enjoyable. They might start to treat their loved ones poorly as a result of burnout. They might become easily upset, becoming more irritable. And in some cases, they might turn to substance use as a way to cope with the stressors. If left unmanaged or unsupported, the risk for negative mental, physical, social, and financial health are increased. So in the mental health domain, the physical health, the psychological health of the family caregiver can be negatively affected by caregiver stress. So higher levels of stress, anxiety, depression, and other mental health effects are common problems among this population. Some estimates show that between 40 and 70% of caregivers have clinically significant symptoms of depression. Some have a loss of self-identity, lower levels of self-esteem, constant worry, or feelings of uncertainty. In addition to the high rates of mental health symptoms among caregivers, there's a physical strain of caring for someone who cannot perform daily activities of living, things like bathing, grooming, and other personal care activities. And this puts many caregivers at a serious risk for poor physical health outcomes. So things like an increased rates of physical ailments, serious illnesses, obesity, pain, and a weakened immune system. There also might be increased alcohol or substance use, maybe lower levels of self-care, and a lower likelihood to engage in preventative health behaviors like going to the doctor and not smoking. It's also notable that women who are caregivers experience many of these negative mental and physical health outcomes at a significantly higher rate than male caregivers. So on top of mental or physical health outcomes, caregivers face a social and financial burden. So they might experience a loss of income and career opportunities, often having to cut back on their hours or leave their jobs in order to meet caregiving responsibilities. And as a result, they might have reduced Social Security or other retirement benefits. There's also significant out-of-pocket expenses for care that might come up, and that they might have to draw from their own savings. And as I mentioned before with some of the coping, some of the things that might come up for caregivers, whether it be a form of coping or a way of feeling like they don't have enough time, is that social isolation, social withdrawal. Because of the amount of stress that family caregivers endure and the risks of unmanaged caregiver stress, it's critical to manage caregiver stress regularly. It's not going to be a one-time thing. It'll continue to occur as long as one holds that caregiving role. And the first task is to remove personal barriers to self-care and to identify what is in your way. For example, do you think that you're being selfish if you put your needs first? Is it scary to think of your own needs? Do you have trouble asking for what you need? Ask yourself what might be getting in the way and keeping you from taking care of yourself. And then seek support and healthy coping skills. So support and coping come in many forms, whether that be prayer, talking to family, friends, or professionals, saying yes to help, taking walks, reading a book, and doing other things that you enjoy. But many caregivers end up withdrawing from friends and family and feeling isolated, like nobody understands them. Support groups can be an important source of understanding and connection in these cases. Next is to reframe your guilt. Guilt that your loved one won't get as good of care if you're not doing it. Guilt that something will happen if you're away. Guilt about having a good time when you know that your loved one maybe isn't. There's not a perfect parent, and there's also not a perfect caregiver in that same sense. You're not selfish to think about yourself, your needs, or your feelings. And next is to learn to set limits and ask for help. So when people offer, take them up on it. If they offer to help you, if they offer a meal, answer with yes. Learning to say no to requests that are draining rather than nurturing also comes up in this area of setting limits. Not getting enough sleep is a major cause of illness and stress in caregivers, and exhaustion is one of the main complaints leading to irritability and guilt. So take care of your physical health by making sure you have regular checkups, getting enough sleep, and exercising, as exercise is even more important as it gives you a break, combats depression, and helps you maintain your health. You can also learn as much as you can about the conditions of those that you're caring for so that you can understand what exactly is going on. So look for local workshops or support groups, not just for emotional support, but also to learn caregiving tricks and to see if you can learn more about making caregiving a little bit easier. You can't know it all though. This isn't a job you were trained to do. So see what your community has to offer, or look online or in your local library for sources of material. Also make sure to take care of your emotional health and get respite when you need it. It's okay to mourn the loss of a loved one, of how they used to be. It can be heartbreaking to watch a loved one change over the course of a disease or chronic debilitating condition, and that's something to take care of yourself for. Take breaks if you're able to, getting support from other family members. If not from other family members, if you're able to, look at adult daycare programs. You might feel guilty, but taking a break might be what you need to avoid feeling inadequate and to avoid burning out. Like, You cannot help others if you do not help yourself. So some specific stress management skills to take away and consider are learning to use stress reduction techniques like prayer, meditation, yoga, tai chi, and deep breathing. It's also important to nourish your body by attending to your own healthcare needs, getting proper rest and proper nutrition, as well as exercising regularly, even if it's only for 10 minutes at a time. Taking time off without feeling guilty about it, and participating in pleasant, nurturing, nourishing activities like reading a book, taking a warm bath, doing something that feels good to you. And then again, seeking and accepting the support of others, and seeking supportive counseling if you need it. And because it's easier said than done, I really want to highlight how important it is to ask for help. So we'll finish or come close to finishing, come close to ending our presentation and talking about how to ask for help. So frequently when people offer help, our instinct is to politely decline. So whether we feel inadequate or guilty about burdening others with our problems if we accept their help, being able to say yes is a critical skill. So one thing you can do to help yourself say yes is to be prepared with a mental list of ways that others could help you if they're a little bit more vague. So for example, you could ask somebody, or if somebody were to offer more vaguely, someone could take the person that you caregive or that you give care to on a 15-minute walk a couple times a week. Your neighbor could pick up a few things at the grocery store. Somebody could help you with paperwork. But when you break down jobs into very simple and clear tasks, it's a lot easier for people to help. And they do want to help. It's just up to you to figure out how to tell them how they can help. So help can come from community resources, from friends, family, as well as professionals. Ask them. Don't wait until you're overwhelmed and exhausted or until your health fails. Reach out for help when you need it. It's a sign of personal strength to be able to do that. So some tips on how to ask for help. Consider the person that you're asking's special abilities or interests when you think about who can help you do what. Try to think of different people that you can ask instead of asking the same person repeatedly. And think about when is a good time to ask them. Maybe don't ask somebody who's tired and stressed themselves. And be prepared for a no. Be prepared for hesitancy, but try not to let it prevent you from asking for help again in the future. It might have just not been a good time. And avoid weakening your request, because your request is important and you can convey that, so stand strong with it. Some resources for caregivers, whether that be yourself or something you want to share with others here. This communityresourcefinder.org is a website that allows you to search for caregiver resources within your community. So you can just type in your zip code to see resources from the Alzheimer's Association, like programs and support groups, programs and events from AARP, adult daycare programs, home health providers, hospice, transportation, attorneys, all of the things within your community. Caregiver.org is a site full of little knowledge nuggets for all of your caregiving needs. It has information and education resources for family caregivers and professionals as well. And then also think about looking for support groups, because there are so many people out there dealing with the similar type of stress. So look for support groups for family caregivers in general, or even for one specific to the individual you're caring for. So for example, look for a support group for caregivers of a family member with Alzheimer's, that kind of thing. And caregiving does not occur outside of cultural contexts. It's important to have access to appropriate resources specific to your circumstances. The APA, the American Psychological Association, has resources for caregivers on caring for a number of populations, including caregivers of of multicultural caregiving, so different racial, ethnic, cultural identities, of different gender identities, of individuals with disabilities, of addictive disorders, of mental disorders, of service members and veterans, different resources for different populations. Something to consider here, this is the last thing I have for you, is a caregiver's pledge. So considering all of the things that we talked about, all of the vulnerabilities that the caregivers are at an increased risk for, and knowing about how to go about managing stress in a healthy way, this caregiver's pledge is something to consider. If you want to take some time to read it, feel free to pause the presentation. Just consider how committing to one or more or all of these 10 points might be a good way to help you maintain self-care and reduce caregiver stress. So that's what we had on managing caregiver stress. Some resources if you're interested in learning more. Again, feel free to reach out if you have any questions at all. Otherwise, thank you for listening and spending some time.